Good afternoon. My name is Kelly O'Connor-Kay. I'm the Interim Executive Director for Maternal Mental Health Now.
Hello everyone, my name is Jasmine Almanza and I'm a third year at UCLA.
In December 2010, two Santa Monica women gave birth to beautiful, healthy baby girls. When they brought their babies home from the hospital, they both expected to feel absolute joy. But instead, they felt sadness, anxiousness, anger, and despair. And they were embarrassed and ashamed that they felt that way. When the first woman brought her baby to the pediatrician for the well baby visit, the doctor asked her how she was doing as a new mom. The second woman was never asked how she was doing. 3 months later, she took her own life due to a severe case of postpartum depression. Her name is Kelly Abraham Martinez, and on the right is her daughter, Melina. As for the first woman, that was me, and this is my daughter, Tatum, on the left. Because the doctor asked me about my mental health, I received the support and resources that I needed. Melina's mom did not. Every year in America, over 1 million women suffer from postpartum depression, but fewer than 1 in 4 new moms is screened for the disorder by their doctor. The mission of Maternal Mental Health Now is to remove the barriers to the prevention, identification, and treatment of postpartum depression in Los Angeles County. We want every new mom to be screened for postpartum depression, and we want all new moms who are suffering to receive proper treatment. We've had a lot of success here in LA County. Cedars-Sinai is now screening every single mom who gives birth there for postpartum depression before she goes home from the hospital. And today I want to tell you about a product that we've developed that we think can help us achieve this goal on a national scale. Bringing Light to Motherhood is an online training program that consists of over 11 courses on a variety of topics related to postpartum depression. Healthcare providers that take our course are able to receive continuing education units in exchange. We're going to offer the course as a bundled course for $495, as well as individual courses for $95. Course titles include Symptoms and Diagnosis, the Treatment Plan, as well as Postpartum Psychosis and Suicide. Our product has already been developed and it's strong. This past year, we raised $30,000 from 60 individual registrations. But we're not nearly reaching the full market. So our goal is to make a significant investment in our marketing and sales strategy to drive revenue. We're going to be targeting individual healthcare providers, including OBGYNs, pediatricians, and labor and delivery nurses, as well as individual mental health care providers, such as licensed marriage and family therapists, social workers, and psychologists. The national associations of these professions have memberships totaling over 1 million people. In addition, we'll be targeting institutional buyers, including the 5,000 members of the American Hospital Association and 1,300 plus federally qualified health clinics nationwide.
Healthcare practitioners need to fulfill an annual CEU requirement in order to renew their licenses. For healthcare practitioners, this is an absolute requirement, and this is a customer need we're addressing through our product. We already have the credentials to provide CEUs, now we need to focus on reaching our target market.
There are a couple of organizations that provide online trainings and CEUs on maternal mental health, and there are even more that provide online training and CEUs to healthcare providers. But what makes our training unique is that it's completely self-paced, which means that the person who's taking it can do so from the comfort of their own home and at their own schedule. They don't need to be in front of the computer on a given time and day to complete the course. The course features a variety of dynamic and engaging speakers who are lecturing on their areas of expertise. And we've made a point to include personal stories of women who have suffered from postpartum depression in each one of our courses. These women represent different races, ethnicities, and income levels, so the provider who's taking the course is able to recognize their patient population. Finally, 97% of our past registrants have reported that they're satisfied or very satisfied with the course.
We will implement a 4-part business strategy. The most important aspect of our business strategy is a healthcare salesperson, which will map out all potential customers and build strategic partnerships with the institutional buyers. The marketing team will focus on the individual customers and implement marketing strategies that target those customers. In addition, we want to revamp our online website to make it more user-friendly and to have it more focused on our online training program. Lastly, we want to offer our users the option of purchasing individual CEUs rather than purchasing 12 at once. So far in 2018, we have sold 60 individual registrations without any marketing efforts or business strategy. In terms of our institutional registrations, we have not sold any, but we have received interest from Kaiser Permanente, Dignity Health, and Hoag Memorial. With the implementation of our business strategy by 2021, we expect to achieve 900 individual registrations and 6 institutional sales, which is only capturing 0.1% of our target market. We believe implementing our business strategy will significantly increase both our institutional and individual registrations. This is a snapshot of our financial projections for years 1, 2, and 3. Year 1's total revenue is based on 150 individual registrations and 1 institutional buyer. Due to the significant investments we're making throughout year 1, we expect to be $52,000 in the hole. However, during years 2 and 3, we expect to capture more individual and institutional registrations, resulting in years 2 and 3 being net income positive. This shows how much it will cost us to acquire a customer versus how much we're selling our online training program for. Due to the significant investments we're making throughout year 1, it will cost us more to acquire a customer than to sell our product. However, during years 2 and 3, it will cost us less to acquire a customer than to sell our product, which is favorable. This is our management team. They have over 5 years of experience in the maternal mental health field. All of them have been directly affected by postpartum depression, so this is a cause that's important to them. Kelly brings in the fundraising expertise, Gabrielle brings in the clinical expertise, and Ashley brings in the business management expertise. They have experience in both the healthcare and business fields, making them equipped to carry out this venture.
Based on our financial model, we're expecting $52,000 in additional costs in year 1 due to the marketing and launch costs. So today I'm asking you for a grant of $52,000 to cover these costs and help make the project a success. 3 weeks ago, I got to take my daughter Tatum to her first concert. It was the Katy Perry concert in Santa Barbara Bowl. Melina's never going to have the opportunity to go to her first concert with her mom. She's going to miss out on all of the firsts. Kelly Abraham Martinez did not want to die. She just didn't want to continue living the way that she was feeling, and her healthcare providers did not have the training that they needed to help her. So for only $52,000, we can make sure that no more children like Melina have to grow up without their moms. Thank you.